Welcome to the FCADC Studio 1900 for another edition of Mike on the Mic.
Yep.
I'm Mike Ross, and I, along with our producer, David Mackley, a.k.a. Bosco, interview local movers, shakers, and policymakers about issues that matter to all of us, or at least most of us, and nothing is off limits. And
Nothing.
today, this is going to be fun, Bosco, because we're going to get to learn about our neighbors to the west, Fulton County, and we have Mike Makosky with us, who is the CEO of the Fulton County Medical Center, and so I'm anxious to learn more about what's going on. And if you've never been to the Fulton County Medical Center,
I've been.
For those who haven't, you have to see it because you will be absolutely impressed what they have in Fulton County. But there are a lot of challenges. But before we get into our conversation,
I think you spoke over there once. That's probably why I was
I think
there.
I was. Yeah, we were working on 1.2 on trying to look at some housing initiatives. But we like the relationship, and to the extent that we can be helpful to the folks in Fulton County, we want to be. But again, this podcast, we're anxious to expand our presence. We're always looking for sponsors, and anyone interested in being a sponsor, you need to contact our office at 717-263-8282 or email david@fcadc.com. And don't put this aside. You could do this right now.
Yeah, not everybody call at once.
Yeah, really. But we do have a sponsor.
We have
Bosco.
one, yes.
So when you think of insurance, who do you think about?
I think of Jeb Keller at Blue Ridge Risk Partners.
Now that's who you should be thinking
I
about
do.
because that's who we use.
We do.
As our insurance carriers have used them since 1986, and we like those folks. So from captive insurance and alternative risk solutions for your business to health insurance for your family, Blue Ridge Risk Partners offers the products, expertise, and service of a top 10 insurance agency right here in Franklin County. Friend of the podcast, Jeb Keller, is always happy to take your call. And if you've never spoken to Jeb Keller, you need to just call him just because it's an experience in and of itself. So you'll come. I don't know if you'll buy the insurance, but you will have an engaging conversation about something.
Something about nothing sometimes.
But he is fun to talk to.
Yeah.
So anyway, but we're going to jump into our podcast today. And again, as I mentioned, we have Mike Makosky with us, who is the CEO of the Fulton County Medical Center. And Mike, welcome.
Thanks, Mike, and thanks, David, for having me. I really appreciate being here, and I'm thrilled to talk about the Fulton County Medical Center.
That's great. Well, we're going to talk about you, then we're going to talk about the Fulton County Medical Center, because I'm always interested with our guests about their background and how they got to where they are. And with you, where'd you grow up?
I grew up in Portage, Pennsylvania, small town up on the mountain between Altoona and Johnstown, where it seems like it's winter 6 months out of the year.
Only because it is. That's why it seems that way. I have relatives in that part of the world, and it is, it's cold, but the folks out there, they love it. So they would not want it any other way.
They do, and it was a great place to grow up. There was a nice park that had ball fields and playgrounds. You could ride your bike, play tennis, play basketball. Just a nice place to grow up. Nice little town.
So you grew up in Portage. Did you play sports in high school?
Not really. No, I wasn't very athletic inclined. I did play some golf on the side, but not really in high school.
Okay.
But there was a nice little golf course there also.
I got into it later. Did you ever go over to St. Francis, over that area?
Yes. It was nice to go over and watch some football games and also to play golf in that.
Oh, there you go. See that? And that is a nice little campus out there. It really is. So then you left Portage. Where'd you go to college?
I went to college. I started at California University of Pennsylvania.
Mm-hmm.
It was a small college, and I didn't know exactly what I wanted to do whenever I grew up, but the computer science and the computer engineering was big. So I started for a bachelor's degree in computer engineering, and it's very math and science intensive. And I was always pretty good at math until I hit calculus, and then calculus was kind of my brick wall. My dad was a school teacher, and he got one of the calculus teachers at the high school to tutor me, and which helped for a little bit, but it was I just couldn't do it. So I ended up graduating there with an associate degree in computer science. my brother at the time was working in a hospital for a company that repaired laboratory equipment, and that seemed interesting to me. So there was a college, Edinburgh University, up in Edinburgh, PA, and they offered a hospital equipment technician program. So I went up there for 2 years and got that associate degree, and ended up landing a job at the Anne Arundel Medical Center in Annapolis, Maryland, as a biomed tech. Biomed techs basically work on medical equipment. They work on computers and telephones, just about everything electronic in the hospital. So I worked there for about 4 years, and while I was working there, I went to University of Maryland and finished my bachelor's degree, because my dad was always good about making sure we finished our degrees, and wanted to I'm the youngest of six. He wanted all
That's an active house.
yes, he wanted all six of us to be school teachers.
Mm-hmm.
Well, my older brother and my two sisters did, and the three younger boys did not. But we all turned out okay, I think so. I think it was good. But
What subject your dad teach?
he was actually trilingual, so he taught German, Russian, and also he taught English. And he taught history.
Russian.
So you know Russian?
I don't. I don't know Russian or German, but he was in World War II, so he was a interpreter for both sides.
Wow.
So you get that. Wow, that is impressive, isn't it?
Yeah.
Really. So you get in. You're in Maryland. You're working as a fixing or connecting medical equipment,
Right.
in the hospital. Okay, and you got your master's degree or your bachelor's
Bachelor's,
degree.
right.
Okay, so then what's the next step in your career?
Well, then my wife at the time got pregnant. We didn't have any family down there, so we decided to move closer to the Portage, and landed in around Cumberland, Maryland, in West Virginia, a town called Kaiser, West Virginia. And there was a small hospital there, 25-bed hospital, very old building, probably built in the 1920s. And I started there in 1990, actually on my birthday in 1990, and was the start of the biomed program there, where the equipment needs to be inspected every 6 months or so. But then it grew into computers, because when I started, I think there was 5 computers in the whole hospital. And of course, that exploded over the 10 years or so that I was there, and just kind of grew the computer area, grew the medical equipment. And as it was growing, I was growing too, and I got interested more in administration of the hospital, because being the technician, you're kind of in all the areas, clinical areas, support areas, and you see a lot of things. As I was working there, I went to Frostburg State and got a master's degree in business administration.
You see yourself ultimately being the CEO of that hospital?
No. My college education got me interested in leadership and in management.
Mm-hmm.
And a lot of the management and leadership theory, I enjoyed learning that and practicing it. So I think that got me more interested, along with the CEO at the time kind of mentored me and was giving me more and more responsibilities. And I did enjoy kind of growing into that position.
I have great respect for the folks in healthcare administration, because I think it is an incredibly complex area of leadership and understanding of the whole system, which seems just to be beyond my understanding.
There's so much to know. With
there really is. So to kind of morph into that role would be something that, I mean, that's one day you're assembling or you're connecting the biotechnical equipment, and the next day I'm running the hospital. What were the hardest lessons to learn when you took over? Because now you're in charge of personnel, you're in charge of all the administration of the hospital, and what were some of the lessons you learned by the kind of trial and error?
I think that, once you're a leader, then I don't know if people expect it, but you expect that you know everything and you need to solve everybody's problems. And you learn pretty quickly that you can't do that.
Right.
That you have to be able to pull your team together and solve the problems together. You can't answer everybody's question. You can't fix everybody's problem. you have to work at it together.
Yeah, and I think that's a great lesson to be learned, because I think sometimes when you get put into a leadership role, and sometimes we carry that sense of, well, when I walk into the room, I've just answered who's the smartest person here, and that's not the case. I mean, you really do need to understand that there are certain things you may have a better understanding than others, but there are other issues where somebody else or others in the room, you need their input because they understand it better than you do.
Absolutely, and that's how my leadership style, I think, morphed from that, because it's more participative. That I can't know everything about everything that goes on in the hospital, so I empower my department heads, and I tell them that they're the CEO of their department, that they need to understand all the aspects of their department. So radiology, for example, should understand the radiology equipment. They should understand the scheduling, where their referrals come from, the finances of the department, those kind of things. And that does seem to help, because, I can help them with certain things. Some of the other clinical people can help them with certain things, and you pull it all together, and that person is the technical expert in radiology. So, it stands to reason they should be the CEO of that department.
No, it's a great leadership style. So when you're in Kaiser, how big was that hospital in terms of personnel? And you said 25 beds?
It was a 25-bed hospital, yes, and it was about 220 employees, something like that.
Okay.
Good many services, but not as many as some other hospitals had. We did have a good surgery department. There was physical therapy, and there was lab radiology, and a pretty busy ER too.
I would think ERs are busy everywhere.
Yes.
And I think it doesn't matter where you are. Those are the folks that can write books, because they see things that they just defy logic.
They live in chaos.
Yes, they do. Some of it's self-inflicted chaos. I think a lot of it's not a lot, but some of it is very much self-inflicted chaos. So how long were you in Kaiser?
I was there for about 19 years.
And how many years as the CEO?
About 6.
6 years as CEO. Okay, so what took you then to say, were you out actively looking for another position to move on or to move up, or what?
Yeah.
Because what got you to Fulton County?
The kind of writing was on the wall, because it was a small corporation, if you will, and the hospital was owned by one person.
Okay.
And he owned about
Wow,
I didn't know you could own a hospital.
he owned about 5 hospitals. He owned one in Texas, one in Wisconsin, one in Kentucky, and then 2 in West Virginia, including one I was at. And over the years, he sold those off. So once he did, then the administrative team got smaller and smaller. So I could see it was pretty much time to go. And I had a good run there. We converted that hospital to a critical access hospital, which helped increase payment to the small rural hospital. And we ended up building a new hospital. We moved out of a 100-year-old building into a brand new building. So it was a very exciting time to go work with the architects and the builders.
Did the owner build a new building, or did you have to raise money through a foundation? How'd you build the hospital?
Well, we raised a little bit of money, but it was for profit, so there wasn't a whole lot going on with that. But we had a consortium of banks that we pulled together, and pretty much floated a bond to do it. And we also used some tax credit money to put in the infrastructure for the water and the sewer and the stoplight and the roads and those kind of things. But it wasn't a very big budget. It was about $12 million to build that building.
So that was in the 1990s.
Yes, it was. Yeah, right.
So did you ever get back to Kaiser?
Rarely, but the hospital there is thriving. It's now a WVU hospital.
Okay.
So
good.
it's doing well.
So there's an opening in Fulton County at the time, or what? How'd that work?
No, I ended up actually in New Mexico. At a hospital in New Mexico, yes. I landed with a company called Quorum, and Quorum was a management company. They would hire the CEO and the CFO to go into the hospital and manage it.
Mm-hmm.
And it was a small hospital, critical access, just like what I came from. They had a little bit more services. They delivered babies there, and a little bit more services. It was a good move for me career wise, because there's a whole different dynamic of people there. There's Native American, there's Hispanic population, and the Caucasian was the minority.
Where in New Mexico were you?
It was a town called Grants, which is about 75 miles west of Albuquerque, kind of in the middle of nowhere. But it was surrounded by 3 Native American tribes. So there was a lot of different culture there, a lot of things to see. So it was interesting. But of course, it was far away from family. And we decided if we find something closer that I'd see.
How long were you there?
About 4 years. That was about from 2010 to about 2014, something like that.
Mm-hmm.
And in 2014, I moved. I found a job with a for-profit company called Community Health Systems, and they had hospitals all across the country. And I thought that'd be a good move, since I could start in West Virginia and maybe move up into another hospital and just kind of grow into bigger hospitals. Whenever I got the job, it was in Bluefield, West Virginia, and the hospital is about a 200 bed hospital. Whenever I moved to Bluefield, my wife at the time moved to Florida, so that was kind of the end of that and a new beginning, if you will. But it worked out okay. I met my wife I have now, who's great, in Bluefield, and we've been married now for about 10 years. And just she had 2 girls. I have 2 stepdaughters, which is great. So it was a good move. But that company, they moved me around to 3 different hospitals in about an hour drive of Bluefield. And I was afraid my next move was going to be somewhere I didn't want to be. So that's when I started looking again and found the position in Fulton County. And it just felt right. Fulton County did. When I did my research, I came up for the interview. It was in February. It was snowy where I was in Bluefield. I came up here, and it was actually a nice day. And met the board. It was a Sunday evening. The board was very welcoming. Had a nice meeting, had a nice dinner with the board that evening. The next day, had a tour of the hospital, met more of the board, talked some more, met the medical staff, met some of the executive team and some of the directors, and it just felt right. It just felt like some place where I could be. The board, nobody wore a tie. Everybody was casual, and I like that because I don't like wearing a tie either. And it just felt like home from day one, and I was glad to get it. I started there in the middle of June of 2018, and I've been there ever since, and just think it's great.
You live in McConnellsburg, or where do you live?
I live over in Woffordesburg,
Okay.
over by by Hancock out that way.
Mm-hmm. Southern Fulton.
Yes, Southern Fulton. Yes, a little bit of a drive, but there wasn't any housing available whenever we moved. But it is a nice house. We like it there, and it's quiet, and so it worked out well.
So you're adjusted to Fulton County. You've gotten to know the folks over there, obviously.
Yes.
Tell me about the Fulton County Medical Center, and tell our listeners because I know you went through. That was a major initiative to build a new facility over there, and you offer a pretty comprehensive array of services for a rural hospital.
We do.
So talk to us a little bit about what's available there.
Okay. The building was actually built in 2008, and then there was an addition built in 2018. And it is about an 80,000 square foot building, so it's pretty big. The new addition has a second story, and the upstairs is the clinics. So there's a family practice, there's a specialty clinic, there's IV therapy, and then now we have an area for visiting specialists, which I'll talk about. But the original building was built in 1950, and it's still standing on First Street in McConnellsburg. It's not being used for anything, but there's a lot of history with the way the hospital started. And one doctor, he was the one that he traveled all around the area looking, taking care of patients, and felt like that we needed a hospital in Fulton County. And it just kind of grew from there. And the people in the county were always giving, and a lot of donations went towards building that original building. And then in 2006 or 7, whenever the campaign started for that building, a person named Helen Overly, she was the one that kind of led that.
Great.
Yes. And she still is very active at the medical center, and she helped get that building going.
I hope the folks in Fulton County have a full appreciation of her, because she has been a dynamo there for a long, long time.
For sure. She'd be a great one to have on your show sometime, too. She'd have some
She's
stories.
crazy. Yes.
But the service we have at Fulton County Medical Center, whenever I started in 2018, that new addition was just starting. It's just opening. So my chore basically was to fill it up with physicians. So we had Dr. Milroth, who was a staple in Fulton County for years and years, and he was retiring soon. And we're able to bring in some very good physicians over the years. Dr. Paul Orange comes over from this area and has a really good following. He's just a really great doc and a really good guy. I really enjoy working with Dr. Orange. Dr. Stearns, another one of our family practice physicians, he's also an ER doc, and he does a lot at the medical center. He's the chief of staff, so he's also a very good physician at our hospital. Dr. Anna Kent, she was over here for a little while, and she's hit at Fulton County, and
Palliative care.
she does palliative care and family practice. Has a nice little practice. Dr. Welsh, who was a local doc who started about 3 years ago and building a practice. And then we have a couple APPs, mid-level providers. Megan Barnett, who was there for
What are
a long
APPs?
time. APP is either a physician assistant or a certified nurse practitioner.
Okay.
So they're people who have advanced training in clinical and physician assistant, but not quite to the level of a physician.
So do you have trouble recruiting doctors or healthcare personnel, given the fact? I mean, what you're doing is remarkable, but it requires pretty much a special person who likes rural living to begin with, and maybe has grown up in that kind of an environment, or is from Fulton County or Franklin County or Bedford County.
Right.
But do you have any trouble recruiting and filling positions?
Actually, we have a very good group of physicians, and we don't have trouble recruiting physicians for the most part. We have a Dr. Jeff Mandek. He's our cardiologist. He drives down from Carlisle every day. So we do have a lot of people that commute in, and probably 50-50 of our staff commute in versus live close by to the medical center. So we have trouble with nurses especially, and nurses, LPNs, and CNA, certified nursing assistants, for our long-term care. Our ER and our acute care nurses, we have trouble, especially night shift, recruiting nurses. And it seems like that we're kind of away from some of the colleges, and some of the bigger organizations scoop up the nurses before we can get to them. So we have a program where we try to grow our own, not just nurses, but all careers related to a hospital. We bring in the 8th, 9th, 10th graders from the area schools, from Southern Fulton, from Central Fulton, from Forbes Road. And even this year, we're going to have Southern Huntington and James Buchanan come up. And we give the kids a tour of the hospital. And we show them the ER. We show them what it's like to intubate the mannequin, if you will. Mm-hmm. We also show them things like the generator, because not everybody might want to be a clinical person, but we need people to take care of the plant and work on the generator and the air conditioning and those kind of things. So we give the kids a good tour of the building and show them a lot of what happens in the medical center. And we say, if you want to stay in the area and you want a good job with the good pays well, look at the medical center, because we're always looking for good people and people that want to stay. Mm-hmm. So that we've done that for a few years, and we're still waiting for some results from that because it's still in its infancy.
Do you have any scholarship programs for those students, so that say, look, we can pay for it, or pay at least partial, your schooling partial, but you have, in exchange for that, upon graduation, you'd come back and work for us?
Yes, we have a very robust foundation, mm-hmm. and our foundation has a very good scholarship program. And every year we give out over $50,000 worth of scholarships to about 30 to 35 students, mainly in the medical field. And we try to get from each one of the three school districts in Fulton County. And every year we have students that go, and we have some. Dr. Welsh actually came from a scholarship program. We have some PTs and some occupational therapists that were also in that scholarship program. We have some nurses, so it does work. It is a very, very good program to help the students. And I don't know how many named scholarships we have, but it's quite a few.
But that need for healthcare workers, the technicians, the nurses, the diagnostic folks, and so on. I mean, you are competing with, over here with WellSpan, with Keystone, with Mental Haven, with Quincy, all of the different healthcare institutions we have.
Right.
And you have, and everybody's got the same challenge of trying to fill positions.
Yes.
So trying to grow your own, I think, is really a major step in the right direction.
Yeah, and I think the kids really respond to that tour. They really enjoy it, and they get a lot out of it, I think. So we just started about 3 years ago, but I think we'll see some good things come out of it.
How many employees do you have at the medical center?
About 350, something like that.
And I think sometimes we forget that's a significant. You're a significant employer.
We are, yes.
I mean, I think when we think of Fulton County, we immediately think of JLG.
Right.
But I think you would have to be, I'm assuming, the second largest employer.
We are.
In the county.
Yes. Now we have the nursing home, which probably about 75, 80 employees just in a nursing home.
In addition to the 350, or is that part of this?
Part of the 350.
Okay.
Yep. We're all in the same building. It's all one building. We have wound care, which is a very nice service. We have a podiatrist, Dr. Gronborg, who works from the knee down with wounds. He's very busy there. And then we have a partnership with Meritus in Hagerstown, where they send up an APP once or twice a week to
You have a
see the
maternity
rest of it.
ward?
We do not. No, we do not do anything with childbirth. It's been years, even in the
Where do
old
the
building,
folks?
I think.
Where do they typically go? To Chambersburg, or to Huntington, or to Bedford, or where?
I think a lot go to Chambersburg. We do have, Chambersburg does have a clinic here in Fulton County Medical Center. They have an OBGYN that comes over a couple times a week, and they see their patients over there, which is a nice service. I'm glad that WellSpan does that.
Okay, good.
So they just rent space, but we do have that service.
So having spent your career now in rural healthcare, what are the biggest challenges facing rural healthcare?
Well, really, the challenge right now is the workforce and just getting those nurses, because we're 21 bed acute care, but we can only take 12 patients because that's all the nurses we have to take care of. We don't want to bring in more patients and not give them the right.
So it's kind of like walking into the restaurant where you see the tables that are vacant, and you say, but we can't seat you because we don't have enough servers.
Correct, yes.
You have this exact same situation.
Right. We keep our nurse-patient ratio to 6-to-1. So that's 12 patients. That's 2 nurses taking care of 12 patients. In a nursing home, we have 67 beds, but we've been capped at 50 since COVID. And we just that staff of LPNs and CNAs kind of dried up during COVID. Now we're starting to rebuild that a little bit. We're seeing some more programs, but a lot of the programs closed during COVID too, for especially LPN. It seems like the kids now are going either into nursing, the RN program, or into the CNA program, and there's not a whole lot of appetite to go into an LPN program.
Mm-hmm. Yeah, I don't envy your challenges there. What about, do you have any access barriers like transportation or broadband or anything that, what is there any barriers to accessibility essentially?
We do have some transportation barriers. It's hard to get the folks here, for their needs. And when they're discharged, it's hard to get them home. We don't have an Uber or anything like that.
Mm-hmm.
We do have some buses that run sometimes and do a good service. The McConnellsburg EMS does a good job of taking care of our patients, transferring them out. And the foundation is actually purchasing a car for our long-term care residents, so we can get them to their appointments outside of Fulton County easier. So there is a transportation barrier that exists pretty much in all small rural communities, I think. Broadband actually has gotten better over the years. Our IT recently upgraded our circuit from 100 meg to a 1 gig, which was huge for us because, the hospital world runs on computers right now. There's a computer everywhere. EMR, the electronic medical record, is in every department of the medical center. And we do some virtual care, some telemedicine. Our doctors that take care of our inpatients, they see the patients over the telemedicine. They're out of the Du Bois area, and we have a very good high definition camera and monitor where they see the patient, and then we have that mid-level provider at the hospital 24 hours a day, so there's eyes on the patient. And whenever that mid-level needs something else, they can dial up the doc, and they're right there very quickly.
What about financial pressures on rural healthcare providers, be it the reimbursement, because how do you manage that? Because it just seems like those are ongoing challenges as well.
Yeah, the financial pressures are the biggest pressures. We have to employ we employ a lot of physicians. A lot of hospitals, they contract with a company, and then they pay the company. But we employ our physicians, and it's a model that works well for us. It's a little bit less expensive. We kind of miss that overhead, with a company, the middle person. But we still got to pay those wages that UPMC, WellSpan, or others are paying, or else we won't be able to find anybody. That's with physicians, that's with nurses, and pretty much everybody else in the hospital. Mm-hmm. So we feel that financial pressure, even though our volumes are a lot lower, and we don't have the resources or the might of Pittsburgh or York that others have. So that's one of the biggest pressures. And since we don't have the nursing staff, we have to contract some nurses, and that's probably 3 times the cost of a nurse that we employ. So that really drains our bottom line and increases our expenses a lot. And then the other financial pressures are really the payments that we're getting. For example, for Medicaid, we get 71 cents on the dollar for Medicaid payment. And with the One Big Beautiful Bill, that's going to go down to 68 cents on the dollar. So that's decreasing. We do have, of course, Medicare is our biggest payer, and they don't pay much better than Medicaid does. And then our contracts with our insurance companies, they pay pretty good. They pay about 80% of our charges, so we do okay with that. But with those reimbursements declining, and the insurance companies putting pressure on us too with denials and rebillings, it's difficult. So
that's when we started the conversation. That to me, the reimbursements and the negotiating with the insurance companies for payments and so on, that just seems like it's a monumental challenge, and it really requires a high level of sophistication on both sides. They're sophisticated. You have to match them with folks that understand that world, and there's not a lot of those people out there.
Right. Medicare, medical billing has to be the most complicated thing. You have your service, then you have maybe 3 or 4 different payers. You have the patient that has a payment, you have an insurance, you have a copay. And all those, has to pay one, then the other, then the other, then the other, and it takes time for all that to happen.
I think if you understand your bill at the end, you're either a healthcare administrator or you're chronically ill, that you're in the system so often you have figured it out. Because I think if you're not there a lot, you get a bill and you have this is not a bill. Then
you may owe, you may still owe your provider.
It's like, oh man, it is complicated. For sure. So you are independent, correct?
Correct, yes.
What are there pressures to affiliate with a bigger regional or provider like a WellSpan or a UPMC or a Penn Highlands or somebody like that?
There's always that choice to do that or not. Right now, we are independent. We're governed by a 13-member community board, and independent hospitals in Pennsylvania are dwindling fast. And over the past 20 years, it's probably went from 30 down to about 10. And it's the way of the world these days. Even with banks, even with JLG, how they had to do it a few years ago.
No, and there are pluses and minuses to both, but I think the plus is that you, being independent, you are totally focused on Fulton County, and you are engaging the community in lots of civic ways as well as being a provider. And I think having that relationship is essential. Same thing with community banks. I think the thing that makes me most disappointed a lot of times is the consolidation within the banking industry and the loss of community banks and the impact that that's had on small communities. And what you're doing is very similar in terms of serving a population that needs the service that you're providing and where they're comfortable receiving it, and everybody kind of gets to know one another.
Right.
And you're in a good position that way.
Our population is very small that we service, so we want to make sure we give them great service every time, and we rely on that repeat business, and we rely on that word of mouth for them to tell their family members and friends what great service they got at Fulton County Medical Center.
So one of the other where we seem to have a major deficiency across the system is in behavioral health. How do you have a behavioral health unit within the hospital?
We don't have a behavioral health unit, but we do have some very good resources in Fulton County. We have a company called Cadenzia, who takes care of some of our ER patients, and also True North. They both work together and take care of some of our patients in need in the ER. Recently, one of our APPs, one of our CRNPs, Levan Harris, went and got his behavioral health certificate. He studied under a psychiatrist for about a year, and just about 2 months ago, he started his practice at Fulton County Medical Center, seeing behavioral health patients, which has been a great service. He's really building well. There's also some behavioral needs in our long-term care, and he takes care of those patients too, and helps with the psychotic drugs and those kind of things, monitoring them. So
Anyway, he can bring somebody in he can mentor that could help him in the future, because it seems to me that it could become almost overwhelming. And just as one person, I think the need is clearly there.
it is a definite need, and one of the things we want to do is to expand that service, maybe with telemedicine, have a psychiatrist on the other end, a couple days a week or something, because these specialists are so busy in their offices that they don't have time to break away, and we really don't have the volume to hire somebody full time. And so what we want to do is try to partner, and we think that the virtual method might be the best way to do it to help Levan too.
What are the biggest issues facing in terms of your patient mix? What are the biggest healthcare issues facing Fulton County?
Really, it's payment and getting paid for what we're doing, and it like we talked about earlier, it just seems like a struggle. And there's been certain models that have been tried in Pennsylvania that worked for some hospitals, but really didn't work for us. We ended up having a lot of paybacks that put some more financial strain on us, with a model that was supposed to take the financial strain away a little bit. So it kind of backfired on us. So if we can come up with some kind of a payment model that takes away some of the administrative burden, that makes it a little bit easier, so you don't have to be a genius to read your statement, that would be huge for the medical community, not just Fulton County, but everywhere. And I'm not sure what that answer is.
No, that's but yeah. As I said, I just think that the position you're in, and I don't know and we mentioned behavioral health. One of the things you hear sometimes is addiction challenges across the board, but a lot of times it's more prevalent in rural areas than we acknowledge. I think a lot of times I think that there's a lot of challenge because a lot of and I just think that it is. So I don't know if you have programs to deal with any of that, or you affiliate with others in terms of treating addictions and so on.
We're just building some of those programs right now. There was a program here several years ago that the psychiatrist ended up leaving, so we had to stop it. But it is something that's on our radar that we want to build if we can find the right partner.
Okay, good. So, but if there's a message that you would like to get out to folks about the Fulton County Medical Center in terms of, just that when you talk to others and you're recruiting folks, what's your message to those folks?
Fulton County Medical Center it's very friendly. There's a lot of people that smile and say hello, and they give you kind of that welcoming feeling. And I hear that a lot from people that come in to visit, and they say, boy, people just here are really smiling and talking to you, unlike other places where they don't. I think one of the things I like to talk about is our ER.
Okay.
Because our ER is small. We have 9 beds, but we have very low wait times in our ER. We kind of get our patients in and out pretty quickly.
That may be something for
Yeah.
folks. So it may be faster to drive to Fulton County for ER than to sit in the ER room here and wait.
It may be.
Seriously, if that's it, because you hear about folks waiting hours, and that's not a knock on. I mean, I think they're just overwhelmed with patients. But especially if you are on the west side of Chambersburg,
Right.
it may be easier just to go to Fulton County to the ER than it would be here. Is that
It would
accurate?
be. Yes, it would. I'm not saying we're perfect, but we do have very good physicians. All of our ER docs are ER board certified. We are a level 4 trauma center, so we do take care of pretty heavy duty injuries. We transfer them out very quickly. We had a farm injury about a year and a half ago, almost 2 years ago, I guess, that the patient came in and had some very bad injuries to his leg and lower extremities. And it happened to be a day where the surgeon was there, the orthopedic surgeon was there, and everybody just kind of rallied together around this patient, got them taken care of, and got them moved to their next level of care, got them up to Hershey very quickly. The patient spent probably a month in Hershey. But if Fulton County Medical Center wouldn't have been there, we didn't have that expertise there, that patient probably wouldn't have made it. So those are kind of things we like to talk about, that if the medical center isn't there, then there's going to be more mortality in the area because...
I think you're providing a tremendous service. You to the point of emergency rooms and just providing service, do you see folks from like Mercersburg using your center pretty consistently?
We see a lot of people from Mercersburg, a lot of people from the Huntington County come down, even some from the Everett area come this way.
Mm-hmm.
So I think the word's out that our ER is gets people in and out pretty quickly.
Mm-hmm.
The other thing we have a good radiology group that out of Hagerstown, and they read our radiology studies very quickly. Sometimes same day, definitely the next day. You don't get that service in Harrisburg or in other big cities. Sometimes you're waiting days or even weeks to get a radiology reading. But we're able to do it pretty quickly. We have a very good group of radiologists.
To that point, so as we move and advances are made in medicine, how does AI impact rural healthcare centers?
We haven't really done much in AI, but
Do you see that effect improving, or being able to compensate for the lack of being able to hire, being able to use more AI to address some of your issues?
I absolutely see that in the future. I absolutely see AI helping physicians with diagnosis, radiologists with readings. I see AI helping to make sure that the medications are right, that the physician and the pharmacist are choosing the right medications, that the documentation is more accurate and done quicker. So yes, there's definitely a lot of advantages to AI, and I'm excited for us to move into that realm at some point.
That's great, great. So I'm looking at the clock here, and it has gone by far faster than I always wanted to. So is there anything else you'd like to share, Mike? Because we appreciate you coming in today and to talk about what you are doing in Fulton County. By the way, you ever eat at Wild Annie's?
Oh yes,
That's great, isn't it?
yes it is.
For those who have never eaten at Wild Annie's in McConnellsburg, it's a fun experience. Food's great, setting's great, and you're pretty close to the Fulton County Medical Center when
Yes,
you're there.
Absolutely. Come over, have your testing done, then go have a nice lunch.
There you go. So maybe sometimes you should go there first,
Yeah.
because they're going to tell you once you get there you're not allowed to eat something.
Maybe.
So, but no. But is there anything else you'd like to share about what you're doing and what we should know?
Well, we're always looking to grow. We always want a partner with the local healthcare facilities. For example, like I said, WellSpan, we partner with them with OBGYN, and they also send over a pulmonology APP that gives us a nice service. We partner with UPMC. They send us an orthopedic surgeon and a general surgeon, and we also employ a general surgeon, Dr. DeBolt. She's really great. She's really a good surgeon, good person, and very knowledgeable. We also partner with Meritus down in Hagerstown. They do our sleep lab and our wound center. So, even though we're independent, that kind of gives us the right, or the freedom, if you will, to partner with these other
Do you
organizations.
do anything with Keystone?
We do not. No, we don't. But
That's great that you have those partners. Anything like with going the other way with Bedford or Penn Highlands or anything like that?
no, nothing with Penn Highlands. They're a little distance, I guess. But pretty much UPMC, we do a good bit with
Okay.
them. Yeah.
Not, well, yeah, as I said, you've built the relationships with the bigger systems and so on, which is great. I just think, as I said, I don't envy what you're doing, but you're also a testament that you can, while your primary focus growing up was never healthcare administration, how you got into it kind of like a backhanded way, but it's worked out well, and your passion for it is obviously very clear and very comes across all the time about your commitment to the folks that you serve. And so we appreciate what you're doing in Fulton County. We appreciate the relationship to our neighbors to the west, and we align very closely in a lot of ways, especially the western end of Franklin County aligns very closely with Fulton County. So we appreciate all what you're doing. Thank you for being part of our Mike on the Mic today.
Thank you. Really appreciate being here, and it was a nice conversation. Thank you.
Thank you.
Great, thanks.
Thank you. So this concludes another episode of Mike on the Mic. We want to thank Mike Makosky, who is the CEO of the Fulton County Medical Center, for taking time out of his day, crossing the mountain and coming to see us.
Yep.
So that was great. And Bosco,
Yes.
let's talk about.
Insurance.
But yeah, well, we need sponsors, man. So we're going to assign you to work a little harder at getting us some sponsors.
My phone never rings.
Well, that's good. We got to reach out. But if you or your business would like to be a sponsor, please reach out to our office at 717-263-8282 or contact our producer Bosco at david@fcadc.com. And don't forget to like and subscribe us on YouTube.
Yeah.
And we're going to see you the next
Yes.
time.
Yes, we will. All right. Thank you.
Thank you.